All right, welcome to this episode of The Drive. We're going to talk about how to lower your inflammation now. Well, starting now, we have programs that everybody can take advantage of. And walking it back, we recently published a book about the SHARP methodology. So what is SHARP? SHARP is what I do to help prepare any patient for surgery. So if you think of the strategies we employ, we look at personal genetic data to see how you detox. We look at a tox test. So in this case, we're using a urine test, and that urine test looks at environmental toxins, things like phthalates. So consider a plastic bottle. A plastic bottle is made firmer by a substance that's called a plasticizer, which in this instance is a phthalate. Those phthalates, if you were to drink a water bottle, some of those phthalates can be transmitted into the water. You can drink them, they get in your system. We can measure that through a urine test because your kidney excretes the toxins that your liver helps break down. So that's just one example. Recently, we had a patient come in, had a lot of trouble with a shingles breakout on their face. They don't detoxify very well. We already know that. But in this instance, on their tox test, they actually had an insecticide show up that contributed to probably their nerve pain. So it's important to look at these things, and especially when it comes to looking at mold toxins, which are called mycotoxins. There's a whole series of mycotoxins. Common ones we think of and are associated with black mold are like ochratoxin. Things that are associated with nuts and grains are like the aflatoxins. Fumicins are associated with fruits. So all of these things contribute to our environmental, our toxin burden load. The other thing you can also have in a large amount is heavy metals. I've had a number of patients, including Lauren Bostic. I went on her podcast, The Skinny Confidential, and talked about her abnormally high amount of heavy metals, which we think was associated to her excessive use of sauna. And her tox test still holds the record for the most heavy metals I've ever seen in a human. The gut health, it's really important to look at gut health. I think a lot of people say they're holistic. Even surgeons who say they're holistic are interesting to me. If you want to be that way and say that, you probably should be carefully looking at people's gut health. And so we have done several tests over time to look at gut health. I'm particularly interested in the balance there, because if you say have a bacterial overgrowth or H. pylori, you'll have difficulty with both absorption and digestion. If you have a candida overgrowth, which a lot of patients have candida overgrowth, that will have to be addressed. What I found lately that I'm concerned about due to just travel outside of the country and the different water supplies we get faced with in South America and even in North America, in Mexico, Central America, is the amount of parasites that patients are getting exposed to, and then having difficulty detoxing or getting rid of afterwards. So think of, one, how you detox. That's a function of your genetics. So I always say you can't pick your parents and you can't outrun a bad diet. So how you detox, and then what is your tox burden? So the tox burden, like I said, how many heavy metals, how many environmental toxins, how many mycotoxins. Once you have an idea of that and the gut health, now you're starting to build a picture, and we add in food sensitivities. Now we look at IgG food sensitivities, which is not a blood spot test like Everlywell, but it is a blood draw. So the blood draw that we do using an LCAT 250 looks at about 250 foods, and the point of it is you're trying to see, are there other triggers? I have a lot of patients who have mast cell activation syndrome or just have higher amounts of histamine to deal with. And so we want to identify what triggers them and then try to help them by giving them that's a tool that they can use when they go to the store or when they're eating out, that helps them avoid certain things that may trigger them. We look at metabolomics. So, all right, what is metabolomics? Think of it like each cellular process creates a chemical reaction. There's different products in the reaction. Many of those products can be measured in the blood, like glutathione levels, palmitic acid levels. And so these can be used to assess and develop an inflammation score. Everybody, asks me, like, why is there C-reactive protein or CRP, quote unquote, normal, but they don't feel well? So that's a really non-specific test that's been around for a long period of time. What I'm interested in is how you detox, what are your toxin exposures, what are these acid levels in the blood, and then finally, like, what is the hormone balance? Just yesterday I had a patient come in and say, female patient, they were losing tons of hair and they didn't understand why, and they were talking about their difficulty with both sleep and stress levels, really difficulty with their diet. Sometimes they drink just a simple fluid like water, and they have trouble with bloating or swelling or pain. So when we have imbalances in our gut, like we described between parasites, bacteria, and fungi, and we have problems with detox capability and a lot of exposures, add in a few triggers with food, you can see how the picture gets very, very murky very quickly for these patients. And so what we do to lower inflammation right away is very strategic, and it definitely is holistic. We know it already reduces inflammation quicker than if you did not do that in the recovery process. So basically, I want people to start by removing gluten and dairy from their diets. And then the way that the gluten stimulates inflammation is something that we want to avoid, as well as dairy, which stimulates inflammation. Now, if you were to examine those things critically in the going back in history, those things probably didn't contribute to as much inflammation as they do now, because those substances that are in dairy products and or gluten products have been modified either through genetically modifying the grains or through the how the CAFOs and all of the dairy has changed because of how the animals are raised and what they're fed, including hormones and antibiotics. So if you want to learn more about something like that, please read Food is Medicine by Dr. Mark Hyman. It's a wonderful explanation of what I just said in much, much greater detail. And so when we say, all right, cut out gluten, cut out dairy, no processed food. So what's a processed food? A processed food, when you look at it, has an ingredient list. So that means it has a label. It may come in a can, a bag, a box. So that's really not food. So food is like a fruit. Think of like a banana. And then for a protein, maybe it's a wild-caught fish, a grass-fed piece of beef, a non-hormone, pasture-raised piece of chicken. So I say these things not to be, sarcastic, but it's critical that you look carefully at the food that you are putting into your body, as well as the fluid quality. In terms of fluids, please drink filtered water out of a metal or glass container, not a plastic container, because of what I said about phthalates. And so these are all things that we can start doing right now to help improve our chances for lowering our inflammation. The other ways I like to lower inflammation outside of, I forgot to mention air quality. Please, an air filter separate from your regular system in your home or condo or apartment, is imperative to clean up air quality. Mycotoxins, especially spores from the fungi, can easily pass through the regular HVAC or filtration system. So we want you to have a better filtration system to improve the air quality. So improve air quality, improve fluid quality by not drinking out of plastic, drink out of glass or metal containers, filtered water, no energy drinks, no juices and things with a lot of sugar in them. And then for foods, wild-caught fish, grass-fed beef, grass-finished beef, poultry that hasn't been, fed hormones, it's been hopefully pasture raised. When you're doing those things, you're already taking a lot of strides to lower your inflammation. The next things would be how you sleep. So try to have your last meal about 3 hours before bed. Stop drinking fluids about 2 hours before bed. The reason is then you'll have to go to the bathroom before you go to bed, and then you can get better, deeper, better quality of sleep. You want to get 7 to 9 hours at a minimum. That will help you lower your inflammation by allowing your hormones to do their best when they're released at night, both growth hormone, testosterone, all the things that help you with recovery, as well as what's called the lymphatic system, which helps really wash over the brain and, if you will, take out the trash and clean everything up so that you feel good when you wake up in the morning. Things that track sleep are Ultrahuman rings, Whoop straps, 8 sleep. There's lots of options for this that are quality. I personally don't like Oura rings. I don't think they're as accurate. And currently, I've trialed some watches, and to date, I don't have an accurate one to guide you with. So when those things are in lockstep, supplementation to help with nutrient deficiency is where I go next. And so, because if you've been following along, I say that there's a lot of problems with the food, and if there's already gut problems, we have to be making sure that everybody who wants to lower inflammation has the right supplementation. So there's a lot of supplements that are formulated in capsules and tabs and everything. So if you already have absorption issues, which most of my patients with higher amounts of inflammation do, I really concentrate on liquids. Liquids, I have found, are key to avoid these absorption issues. So we use liposomal glutathione, liposomal vitamin D3K2, we use liposomal vitamin C, we use liposomal methylated B complex. Those are like my core 4. And then we add in glucarate and glycine, carnitine. There are some things that we feel are going to boost your ability to both get nutrients and to detox. So all of those are included in our inflammatory support bundle. So when you navigate to my webpage, drrobertwhitfield.com, you'll see a series of options. You can learn about lowering inflammation by buying my book, reading it, listening to it. You can sign up for a webinar about how to detox without retoxing using the SHARP method. You can purchase supplementation like the inflammatory support bundle. That will help lower your inflammation. If you're a professional or practitioner, we can actually help you with training regarding how we lower inflammation and then work with our patients. And if you're a surgeon, you could submit a resume and we can evaluate it to help you train in our system. So that being said, now we've really summarized, let me summarize all the things you can do right now that are relatively simple to take action to lower your inflammation. 1, control the fluid you put in your body. Number 2, improve your air quality. Number 3, really improve and upgrade your food quality. Number 4, you can actually just lower inflammation by doing some simple things with nutrient supplementation that's liquid-based liposomals. So go to our site, get the inflammation support bundle. So that's an action you can take right now. You can read the book or listen to the book. It's very simple. I break everything down in the SHARP method book. And then I'm going to go back to sleep, because I think if you prioritize sleep above everything else, you will start to feel better. So eat your last meal about 3 hours before bed. Drink your last fluids about 2 hours before bed. And let's just be clear about this. I don't want you drinking alcohol before you go to bed. That is going to lower your heart rate variability and decrease your chances for a good night's sleep. So let's just concentrate on filtered water and stop doing that 2 hours before bed. If you need a sleep supplement, here's my recommendation: melatonin SRT, calming sleep support, and Mag Boost from our store. That's called the Sleep Bundle. That's what I use. Just do one of each. Melatonin SRT helps you stay asleep throughout the sleep cycles. And Mag Boost contains mag-bisglycinate, which is the best mag for sleep. And then Calming Sleep Support has a lot of adaptogens, including ashwagandha, which has been studied and shown to really be great to relax you and help you get off to sleep, as well as L-theanine. So these are my tips and tricks. You can help lower inflammation right now. Go to the website. Really pick something that fits what you want to do to help lower inflammation now.